John Prosser II, Health Partners of Michigan, is here, and Scott Berry, too. And you have Capital Day going on, both of you, and many others, right across the street from our studio here. Tell us what that is, what your mission is, and how it's been going, because this has now been about a 3-year journey for us. 4 years now.
At least.
4 years in the making.
Well, the Capital Day, Michael, is all about the Brain Injury Association members from all over the state of Michigan coming to the Capitol in a united force. And today's focus is, of course, the coalition protecting auto no fault. When you say, yeah, it's been 4 years, presently we're dealing with Senate Bill 248, which the coalition has been opposed to as written, as passed out of the Senate. But we do believe that there's room for reforms. We do believe that we might come to an understanding with the legislature. And we're working on that diligently with a leaning towards optimism that we can finally put to rest what the insurance companies have hoped to do, which is get rid of the finest model in America for the care, recovery, and rehabilitation of catastrophically injured Michiganders who are
Scott,
out there.
You're from Centria in Brighton. It's interesting to hear John talk this way, because the legislation in the past that you have had to defend, you definitely were Dr. No. Like, this is dangerous for people. This is terrible for the system. We've had the finest model for over 30 years. Why tinker with it? Now you sort of moved a little bit to, well, maybe we can, quote unquote, actually reform instead of destroy.
We have great unity. We have 30 different associations that are members of the group, and we are collectively sitting down and talking to legislators that are supportive of preserving, protecting, and strengthening no fault on both sides of the aisle. So we see this more as a, it's really about health care for catastrophically injured people. It's not so much a political issue, although it's played out in the political arena.
Yes. So remind everybody again, including the legislators, because you might have some new ones today, right, that you're
Yes.
going to lobby when you get over there.
Yes.
Boil it down. If you walk into a legislator's office, and you will, I presume today, or you'll meet with them somewhere, the nut of this issue is money versus health care.
Versus care, yes. That's correct. Really what I would say that our biggest issue with the bill as it was written is that it was very one-sided. It made anywhere from 6 to 10 asks that have been central to the insurance lobby's agenda for the last 4 years, but it didn't really do anything to clarify or improve or strengthen how care was going to be delivered to patients and to really anybody who had to access benefits under the no-fault system. So like John was saying, we're definitely, we would like to see reform. We would like to see things like fraud in the system be cut down, and we think that we can come together with the insurance side of things on that issue. But what we want to make sure is that all patients that need to utilize care under this system have access to that care and have a clear understanding of how that's going to work, and that is properly funded for companies that specialize in this type of catastrophic care.
The most important element is that if you're in a catastrophic injury, you have lifetime care, no concerns, your family's not going to go bankrupt, you're not going to be given care that isn't suitable.
That's right, Michael.
That's it. That's what you're trying to protect.
Well, there it is. For $150 has been the recent average. I mean, last year you paid $186, but we thought that was a little bit inflated. So for $150, you protect your family from bankruptcy. You don't get cost shifted to Medicaid. And you have purchased the greatest value in America. Many people argue price. They say, oh my, we can get a lower price in a different state. The question is, what is the value of that purchase if it does not provide what you need? If you go bankrupt and you fall to Medicaid and you suffer from neglect and you die prematurely, what's the value? Zero. Michigan has the finest value because we're unique in all the country. We created this unique model because the legislature said, wait a minute, this population, they looked at this 40 years ago and said, this population of brain and spinal cord injuries is underserved and undercompensated. We can do better than that. So we used a model that's been used in the insurance industry for over 100 years, reinsurance. And so we the people, we the drivers, fund the catastrophic fund, which presently hovers around $20 billion, Michael. And you'll remember the insurance company said in 2011 that this is an unsustainable model with just $14 billion. So here we are with $20 billion, and that's why we want to protect it. We want transparency on that $20 billion, and we've been asking and asking and asking, and we know the legislature can do that. We're not really certain exactly what the reason for the reluctancy is.
And the argument that there should be a cap.
It's a ridiculous notion. I mean, if you look at the history of the claims for the last 10 years, steadily the claims have gone down and steadily the resource has increased. Why would you put a cap? The only way to be honest about it is ask, what if this happened to you or somebody you love, your mother, your daughter, your lover, your friend? What if it happened to those people? What would they need? And so if you look at the reality, Michigan creates home modifications, electric wheelchairs, around-the-clock nursing care, aggressive, persistent therapies. If you don't get those, Michael, your mind and your body are going to atrophy. That's why we turned our attention and said the priority in this scheme is the care, the recovery, and the rehabilitation of catastrophic injuries. You do that with treatment. You do that with therapy.
So, what do you want to pay for that? If it's $150 a year, what could you possibly save by remaking the model?
You really couldn't. I mean, I think people pay about that same amount for the insurance on your cell phone.
Yeah.
John had a really good point. Everyone talks about insurance pricing, and then the insurance companies have done a great job messaging that, it's because of these benefits, it's because of these benefits. Well, that's only part of the equation. The other part of the equation is how much the insurance companies arbitrarily decide to charge people, whether that's, $10,000 to insure a car in Detroit or $2,000 to insure a car in a more rural area. And I think it's really great that CPAN is actually working on addressing that issue in our substitute bill.
John Prosser has for 4 years. Scott Berry has this morning, too. That's the way it is.